Episiotomy, when it is needed and when it is not. An episiotomy is a cut or incision made in the tissue between the vaginal opening and the anus during childbirth. This area is called the perineum. Although an episiotomy was once a routine part of childbirth, that is no longer the case. If you are planning a vaginal delivery, here is what you need to know about episiotomy and childbirth. Routine episiotomies are no longer recommended. Still, the procedure is sometimes needed. An incision might be recommended if a baby needs to be quickly delivered because the baby shoulder is stuck behind the pelvic bone, the baby has an unusual heart rate pattern during delivery, and forceps or vacuum extraction needed during a vaginal delivery. How it works? If you need an episiotomy, you typically won't feel the incision or the repair. If you haven't had anesthesia, or if the anesthesia has worn off, you will likely receive an injection of local anesthetic to numb the tissue. Your healthcare provider will discuss different techniques for improving your comfort as you heal. There are two types of episiotomy incisions. The first one is midline incision, as you see on the image. A midline incision is done vertically, and a midline incision is easier to repair, but it has a highest risk of extending into the anal area. The other is mediolateral incision. A mediolateral incision is done at an angle, and a mediolateral incision is less likely to result in an extended tear into the anal area. However, this incision is often more painful and more difficult to repair. When we see the risks, episiotomy recovery is uncomfortable. Sometimes the incision is more extensive than a natural tear would have been. Infection is possible, and for some, an episiotomy causes pain during intercourse in the months after delivery. A midline episiotomy puts you at risk of 4th-degree vaginal tear. This type of tearing extends through the anal sphincter and into the mucosa membrane that lines the rectum. Fecal incontinence could also result. When we see healing from an episiotomy, any stitch used to repair the episiotomy are usually absorbed on their own. You might take prescription medications or use a non-prescription pain reliever or stool softener. However, pain relieving creams or ointments haven't been found to be effective for episiotomy wounds. While you are healing, expect the discomfort to improve over time. Contact your healthcare provider if the pain gets worse. Also call your provider if you develop a fever or if the wound produces pus. This could be the symptoms of an infection. Thank you for watching.